Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the June 12, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 6 new COVID-19 cases since yesterday. As of June 12th, Dubuque County has 381 positive COVID-19 cases. That's a rate of 393 per 100,000 population. No additional deaths were reported, so a total of 21 deaths in Dubuque County remains. 6,604 people have been tested, and about 6% of the cases tested in Dubuque County have been positive. 3 individuals are currently hospitalized, which is a decrease of 3 since yesterday. Good news. 217 people, or about 57% of Dubuque County positive cases, have recovered to date. 1,204 Dubuque County residents have had serology or antibody testing, and 71 of those, or just under 6%, have tested positive for COVID-19 antibodies. The state positive serology rate is about 8%. The state added 364 cases since my report yesterday. As of June 12, 2020, Iowa has a total of 23,261 positive cases. In all my years of public health practice, I've never seen a disease with that many cases. In all, about 1 in 15 Iowans, or just over 213,000 people, have been tested. About 11% of Iowans tested have been positive. Unfortunately, and I'm sad to report, 4 additional deaths in the state since yesterday, for a total of 643 Iowans. 44% of all Iowa COVID-19 cases are in the 18 to 40-year-old age group, with the highest incidence of death continuing to be in the greater than 80 years old age group, with 47% of the deaths. Currently, 225 cases are hospitalized throughout the state, and 14,071, or about 60% of Iowans, have recovered. So have you seen the study from the CDC about the one symptomatic choir singer who turned out to be COVID-19 positive and infected 52 out of 61 other people who were at a 2.5-hour choir practice? 3 people were hospitalized and 2 died in this very unfortunate event that happened back in March, during the early part of the pandemic. This event resulted in what public health calls a high attack rate, or a lot of people becoming infected from one event from a virus. We've found others like this with COVID-19. It also brings to light the public health infectious disease concept of super spreader, and in this case, super spreader of COVID-19. Super spreaders have been described for other diseases, including German measles, tuberculosis, Ebola, SARS, and MERS, both of which are coronaviruses, and now COVID-19. A super spreader can be described as a minority of individuals who disproportionately infect more susceptible contacts, as compared to most people who infect few or no others. Super spreaders have been noted far back in our history and are known to amplify outbreaks of disease. Ever heard of Typhoid Mary? She was a real person. Between 1900 and 1907, she infected 51 individuals with Salmonella typhoid, 3 of whom died, even though she had no symptoms but carried that Salmonella bacteria around in her for years. It is still unclear why certain individuals infect disproportionately large numbers of secondary contacts. Things like the increased strain virulence or higher pathogen shedding, and differences in the person or the host where the virus or germ is living are potential explanations. But we really don't know the exact phenomena that causes 20% of the people that are super spreaders to infect up to 80% of the transmission events in the population from many diseases. Each pathogen or virus or bacteria is different in the super spreader effect, and each outbreak or pandemic, as is in the case with MERS and SARS and COVID-19, presents specific insights into factors that might shape how these super spreading events occur. So we may or may not discover the specific reasons why some people spread COVID-19 to more people than others. Keep this in mind as you're planning your weekend and upcoming summer activities. You can't tell by looking at someone if they are a super spreader. As I emphasized yesterday and many times before, this COVID-19 pandemic is not over. We are learning new ways to live with it, but it's not over. So this weekend, get out and enjoy the summer and fresh air with some physical activity and just taking time to think, even if it's about nothing important. We all need to take a few deep breaths. Thanks for tuning in today. Let's all continue to be safe and practice proper public health measures. Be smart. When in doubt, don't go out. And remember, we're still all in this together.